Hello, my name is Jonathan, and I'm here today to present to you the first of the three courses of the first level of the Unified Acupuncture Theory series. This course is titled Dance of the Channels, and it focuses on channel interactions and holography, with a focus specifically on how to treat pain in the clinic. Now, this course has had many titles in the past. For example, it has been called the Foundations course, etc. Today, we're going to be focusing on calling it Dance of the Channels. It links back to a book that was written in 2022. So, what is it about this course? How can it be what happens in this course? Well, in this course, we study holography. Now, holography often, well, I'm going to explain it in a moment what it is, but it's called imaging and mirroring. So, we're going to be looking at holography. We're going to be re-examining our understanding of yin and yang and specifically looking at them in relationship to acupuncture and acupuncture channels. We're going to be presenting the unified acupuncture theory model. We'll be looking at how to diagnose based on channels. And we'll be looking at the six systems of channels interactions. And then there's a whole series of integration of how we apply this in the clinic. And then, of course, the course always finishes with a summary and understanding how to navigate the system easier. So, what do we mean by holography? Well, we know that when we've studied acupuncture, the point bladder 40 is often indicated for pain in the lumbar region, especially around L2, L3. Um, and that's it. It's just written, this point does that. Sometimes called for the Hussey point region. Well, we can also look at from an imaging region. So if we look at the back and we look at the legs, we notice that the pain in the back is an image of where the knee is. So bladder 40 is halfway. I know it's not exactly halfway, but there's a whole bunch of reasons for this that we go to in the course. That bladder 40 is the image of the lower back region. So once we see it's the lower back region, we can understand why the bladder channel would treat the bladder channel. So this is an example of holography. It's where we're using distal aspects of the body to image where we want to be treating the patient. And what this does is it allows us to not have to needle locally, have an understanding of how we can needle from a distal aspect of the body. This is one part of the distal needling acupuncture. The other part stems from this. This is called Unified Acupuncture Theory Model, and I'm not going to go into its whole details now. But what this does allow us to do is it allows us to see different channel interactions. We're able to understand which channels interact with which other channels. So I'm sure you've noticed, for example, if you have a bladder problem, some channels will actually affect it. For example, the kidney will have an interaction with bladder, the heart, the small intestine, and maybe the lung. But if you use a stomach channel, it's not going to have the same effect on the bladder channel. So we're going to look at the six different channel interactions that exist and how each channel's interactions are. When we put the two of those informations together, we're able to apply distal acupuncture. So what does this core cover? The theory, we look at holography. So we look at understanding this imaging and mirroring of distal aspects of the body. We look at the whole body, the head, how to image the head onto different parts of the body, the head and the torso, just the torso, the limbs, etc. So we look at the holography. The next thing we look at are the channel interactions, and we study all six systems of channel interactions. What are their bases? When can they be used? When can't they be used? And then together we put that together to understand our distal needling technique. So, what is this useful in the clinic? Well, this is a pain treatment. We can use this to treat any type of pain, from muscle pain to bone pain to ligament pain to headache to tension, as long as it is located in one particular part of the body. And we'll look at what that means from a diagnosis point of view and then from a treatment point of view. So what is, how is this course useful? Well, we get to treat distally, and treating distally has a couple of wonderful effects in the clinic. First of all, it allows us to get instant feedback on the efficacy of our treatment. If we put a needle where the pain is, we can't then ask to move the joint or to move the area to see what has changed. However, when we distal needling, and then we can ask the patient to move their shoulder, we can see if range of motion improved, has pain improved, etc. So it gives us efficacy, gives us feedback on the efficacy. It also helps the patient to have trust in the system. Because it's not, we put the needle there and the pain goes away, but we put needle far away from it and the pain goes away. There's a whole mechanism that gets activated, which allows the patient to have confidence in what is happening. So in the clinic, it allows us to treat pain distally, get our efficacy from what we're doing, and also to create trust and have the patient engaged in the process. From an acupuncturist and maybe an acupuncture student point of view, will also give us a better understanding of our point selection. When we can use this idea of holography and channel interactions as to why points work, we're going to start choosing the point that's more adequate. When we might have 5 points, we will be able to use these two pieces of information to help us choose which point works better. And then also from another point, it's also going to help us demystify some of the point actions and the point indications. We don't have to memorize it. We can understand it from a logical point of view. And of course, it gives us instant feedback on the efficacy of our treatment. So this is the Unified Acupuncture Theory course called Dance of the Channels. And I hope to see you soon. Thank you.